In this video, I'll be showing a stretch, strengthening, and home care for a client that presents with a carpal tunnel syndrome. What carpal tunnel is a compression on the carpal tunnel which runs across the wrist here, and it causes the median nerve, which innervates half of your hand, to present in a tingling sensation in your fingers. So for the stretch, it will be not really sure the name of the stretch, but what you do is you take your head and you tilt it to the opposite direction. So if your right hand is affected, you tilt your head to the left shoulder, extend your arm like so, and point your wrist down like that. You do that all together so it'll look like this. And you're going to hold that for 30 seconds. So the point of that is to try to alleviate some of the pressure on the carpal tunnel. The goal is to minimize the tingling sensation and reduce the pins and needles. Like any stretch, you want to go into it slowly and come out of it slowly and hold it at a spot where you're just feeling slight discomfort, not where it's painful. If there's any extreme pain or it makes it worse, definitely stop and we can reassess that as well. So you're going to hold that for 30 seconds and you do whatever sides are affected. So if just your right side is affected, just do your right side. If both are affected, then you can use doing your left side as the rest time in between, because you're going to do it twice on either side if both hands are affected. If not, just take 30 seconds rest in between and repeat. So we're going to do that twice a day for the next 3 to 4 weeks. The strengthening exercise is just going to be a simple wrist flexor curl. So you don't want to use your biceps. You don't want to move your arm. Your arm stays, I keep it at 90 degrees, and just bring your wrist towards your shoulder like so. And you're going to you can use anything around the house that is just going to add a little bit of weight. Nothing too heavy, just to kind of give you a little bit of resistance when you're curling your hand in like that. You're going to do 3 sets of 12 to 15. The goal is to strengthen the muscles of the forearm. That will as well likely reduce the pins and needles that you have in your hand. So like I said, 3 sets of 12 to 15. And if there's any negative side effects, any pain or discomfort, we'll definitely revisit and we can find something else for you to do. You're going to do that for 3 sets of 15 for the next 3 to 4 weeks. And for that, you're going to have about a minute of rest in between each set. So if your both wrists are affected, do your one wrist, and then by the time it takes to do the 12 to 15 reps the other, you'll be good to go back to the other wrist. Again, like find any kind of object around the house, and when you're going into it, just you don't want to jerk into the movement or go in too quick. It's just a nice, slow pace up and down. You do like a tempo of 2 up, 2 down, and that's perfect. Make sure you're breathing the whole time while you're doing it as well. And the home care for this, I would say if you have the wrist guards that keep your wrist in an extended position, definitely use those when you're sleeping, but not everyone can afford that. So another option for just something that you have around the house is just cold packs. So what you want to do is get a cold pack out of the freezer, wrap that in a towel so you're not putting the cold directly on your skin, and place that on your forearm, right on the carpal tunnel right there. And you're going to hold that for 5 minutes or C-band, whatever comes first. So what C-band stands for is cold, burning, achy, and hot. So you don't want it to get to that point. When it gets to that point, you just take it off. Sorry, cold, burning, aching, and numb. So when it gets to the numb stage, definitely take that off because then it's too cold and it could be unsafe.